Hello everyone and welcome to Module 5 in Nursing 323, Health Assessment for Registered Nurses. Today we're going to go over, as we do weekly, Module 5, Responsibilities, Assignments, and Activities. So this week we will be focusing on the breast disorders that occur in both men and women, also your respiratory and cardiovascular system, as well as the peripheral vascular and lymphatic system. You do have an overview of this week's learning objectives as well as module objectives and your learning outcomes. Let's focus a little bit on your to-do list. So we will be having you read chapters 17, 18, 19, and 20. You do have a discussion forum this week, and you also have shadow health assignments, and then we'd like for you to continue working on your personal wellness plans and record your progress with this assignment. You also have videos that will help you review each system that we will be reviewing this week. And those are associated with each chapter. Again, breast, lymphatic, peripheral vascular, cardiovascular, and respiratory. Next, we have a discussion board this week that is posed of a case study as usual. You'll be participating in each one of your groups. Please be sure to respond to your student peers as well as any instructors or teaching associate feedback that you receive. Potentially the discussion does not end until Sunday evening, so you want to be sure that by Sunday evening you are checking back into the discussion forum to see if anyone has asked you questions, as your overall responses to feedback and discussion amongst your peers and instructors is calculated into your discussion grade. As usual, if you have any questions about the rubric or the requirements and criteria for discussion, your discussion rubric is attached. Your shadow health, cardiovascular, and respiratory system assignments are due this week. As usual, when you log into Shadow Health, be sure that you are in the correct section, and do take the time to log back in and reattempt your assignments if for some reason your DCE score is not what you feel that you can do as far as your most optimal grade. Again, we allow you as many times as you want to reattempt these assignments, so please be sure early in the week to start out reviewing these assignments and talking with your patients and practicing your documentation and your overall transcript, because this will be calculated, the documentation and transcript will be calculated into your overall comprehensive shadow health assessment. This week we also have shadow health cardiovascular and respiratory concept labs. Now these labs, just like your conversation concept lab and your orientation, will not be used for a grade, but they are a pass-fail assessment. We basically want you to enter them and listen to the heart sounds and the lung sounds that are offered in these labs. Again, the concept labs, both respiratory and cardiovascular, are not for a grade, but we would like for you to complete them in order to advance your learning. The shadow health respiratory and cardiovascular assignments are for a grade, just like your usual shadow health assignments for your DCE scores. Again, please be sure to be practicing your documentation, as your documentation does not count for a grade in your single system labs. However, your comprehensive health shadow health assessment grade does include documentation, so you want to be sure you're practicing that and looking at the feedback in the shadow health program. I believe that's all I have for you this week. Should you guys have any questions, please feel free to post those to the Learning Cafe or email me directly. Have a great week.